Hello, and thank you for joining us for this webinar about hometown health, refining the customer care experience and Parlance's partnership with them. I am Sheila Kelly, and I'm with Amy Bechpahani from Hometown Health. Amy is the Director of Customer Service at Hometown Health and has been in that role for a bit over a year and a half now. And I'm the Senior Account Executive that works with Hometown Health. A little bit about Hometown Health. You can see here a unique business model, relatively unique in the United States, and started by Renown Health, owned by Renown Health, but with a very big and growing membership base. You can see that over the last 7-8 years, look what's happened to the number of members that they're servicing. This is a great thing. They're expanding into Las Vegas, etc. But with it comes a lot of challenge. Amy, you want to talk a little bit about the customer care center services?
Sure. Hi, everyone. Thanks for having me. Hometown Health is a local, not-for-profit health insurance agency. We are one of the very few health insurance companies that is owned by a hospital. So as an entire network, we are 7,000 employees. Hometown Health specifically is 250 employees. And as Sheila said, we have seen exponential growth. We now service, we're approaching 170,000 members that we service from an insurance standpoint. We offer products that are commercial-based, Medicare Advantage plans, self-funded plans, our Senior Care Plus product that you see on the far right. Big product for us, very important, roughly about 45,000 members there. And we, as Sheila said, we right now are in Reno, and now we are stretching down into the Las Vegas market. And then we also offer wellness products. So that's for companies to be able to partner with us so that they give their employees insurance incentives on their premiums that they pay their employer. And Healthy Tracks is a wellness program. So we have many programs that we offer, and we're growing so fast. So that's a little background of Hometown Health.
Thank you. Let's talk a little bit about what you've got going on in your contact center now in terms of infrastructure, just a short overview so folks know what we're dealing with.
We currently use, Renown Health as a whole has two different systems. The Renown system is on Cisco already. The Hometown Health system is still on Avaya, and we will be migrating to Cisco in the next 6 months.
Great. And now I'd like to kind of move into your change, your recruitment over to Hometown Health, and sort of what that initial experience was like. Talk a little bit about coming in and what you saw as your opportunities and et cetera. You want to talk about that change? Yeah.
I've been with our organization as a whole for 6.5 years. I worked at the hospital for about 5 years, and so I did the call center there for scheduling appointments, emergency calls, hospital-based, those things. And so I migrated over to Hometown Health in their customer service arena, and we focused on areas such as improving our service, and obviously service means a lot of things as far as solid metrics, with your average speed of answer, our wrap time, our abandonment rate, but also improving our service from a more emotional standpoint of making sure that our members felt that they got to the destination quickly and without error. Also in Hometown Health, since we are branching out, we wanted to raise our competitiveness. We want to make sure that Hometown Health is very, very unique. We truly mean that we are in your hometown, that we truly care about every single member. Every member has a voice. And so we don't want to just be another global conglomerate health insurance entity. We want to really make sure that our members feel that they are each a different person and they each receive the experience that they desire. And so we're looking for some telephony systems that will assist us with that. Of course, even though we're not for profit, it's important for us that we focus on products that not only will improve our customer service and the customer experience, but also improve our revenue. For those of you that may or may not know, when a insurance agency improves their revenue, it actually helps to lower premium costs, and it also helps to acquire better benefits. For us, because we're not for profit, we have one of the lowest overhead costs, overhead fees, and so all the money that we profit from goes right back into our members to lower their premiums and add new benefits onto the plan each year. So those are kind of the three goals that we were looking for when I transitioned over to this role.
Oh, that's great. Good. Thank you for that overview. Let's talk about okay, you've accepted the challenge, you're moving over to the new organization, and um, what was right up front? What did you walk into?
Um, we we have been here for 30 years, and with that also that some of the challenges where we had a lot of individuals that were still here for 30 years, and also we had systems that were still here from 30 years. And that's not any fault of any one other person. I think we can all understand that you build something and then you kind of move on and you forget to go back and attend to it. So, but why that's important is because we are finding that the rhetorical feedback that our members had, and they were saying about their experience with their phones, was not matching with the reports that I was finding. And I was also trying to really having a hard time nailing down when callers said that they couldn't get through the system, if they said that it took 10 minutes, I just was having a difficult time tracking that. So that was a primary challenge of trying to find a report that I could trust and that I could rely on to match the member experience.
So kind of a lack of data there and a lack of visibility.
Yes.
Right. And we're seeing on this slide sort of some primary challenges of, just right off the bat, you're coming in and noticing that there are some right up front aspects of the caller experience that seem compromised. It takes a long time to navigate to the agent they need, the service personnel they need, and a fair number of people are hanging up or incomplete interactions there.
Yes, we would. I think just to really, we all know that there's data as far as how someone manages your IVR, but then there's data about how long someone is in your queue, and we weren't finding data that assist us to understand their experience during the IVR.
Right. Oh, yes. Thanks for clarifying that. Good. And that leads us to sort of you get in and you start getting the lay of the land. We've talked a little bit about the lack of visibility that you were finding through the reporting that was sort of in place already. You want to talk a little bit more about what some of the hard truths you were facing at the outset?
Sure. As Sheila mentioned, these were the goals. I like aspirations. These were the things that I was asked to improve when I first came over, and everyone's excited and ready for the challenge. But with that, I realized that in order to improve these things, I had some barriers. So this slide is very representative of that, in that I was asked to improve the service levels, but I couldn't do that because I didn't even know a true representation of what our service levels were. As I said again, that I was having a hard time matching the data that I had access to and getting it to correlate with what the members were saying. Um, we could tell that there were some abandonment issues, but we couldn't tell where they were lying. Was it due to representatives not answering the phones timely, or was it due to an IVR? Was it due to behind the scenes like telecom issues? We were having a hard time figuring out exactly where that issue lied and to solve it. And then overall, it's kind of a subjective way to measure. It's hard to measure a customer experience, but we did find that because we're talking about the great experiences, we had an experience with both our customer service reps and the actual caller and the culture of that. So the callers calling in had their own idea of what the culture should be, how they should be treated. And then our customer service reps had their own idea or culture of how they should treat the callers, how they should, be at their desk or not be at their desk. And this was deep rooted. And as I've said, a lot of one of the biggest proud moments of Hometown Health is there was a lot of tenure individuals here. And we all know that what comes with tenured individuals, though, is sometimes that they have kind of been staying in the thing that always made sense to them. And not that they don't want to improve or move better, but maybe they aren't aware that there are some other options out there or changes that we need to make. So definitely dealing with a culture that needed some assistance with wanting to be more progressive and move a different direction.
Okay, and so this is where parlance starts stepping into the picture. You recognize you've got this lack of visibility and you've got some real issues, and you've got a relationship with parlance that you've brought forward from Renown Health. And just a little overview there. Parlance came into Renown Health several years ago when they were looking for ways to better route calls to scheduling agents and also to make better use of more efficient use of PBX operators. So there's a call center there that encompasses two business functions, the PBX operators and the centralized scheduling center. And Parlance came and worked with Renown to enable call routing with speech-enabled call routing, adaptive speech automation, and also provide some insight into the kinds of calls that were arriving at each number and what those callers were wanting and how better to serve their needs. And here you can see here some of the change we were able to help implement there. And this provoked Amy to reach out to us, having known us now that she's at her new home of Hometown Health. And Amy knows from her work with Parlance that we also do some work around call path analysis from the point of view of the caller. So it was a real good opportunity to look at CX insights delivered by Parlance that really looks at what's going on with the caller from the moment the phone is picked up in your organization to the time that caller hangs up. That call could navigate your IVR technology. It can move on from there to an agent and perhaps needs to move on again to another department and another agent. Let's figure out what this is like for the caller and what is actually happening with the caller. You can see here this depiction of a call path. And in the case of Hometown Health, Amy's saying, I want to know how people are navigating the IVR. I want to know what the agent experience is like. I want to know what the transitions are like. And this could be a good opportunity for Parlance to come in and help take that snapshot of that customer member calling experience and provider calling experience into the contact center and give Amy what she needs in order to develop a strategy around improvement. In this situation, this slide here is sort of what we see often when we're talking with contact centers at Parlance is that our customers have a great idea, a great sense of knowledge of what's going on with their representatives who are talking on the phone and maybe with some other aspects of the caller experience, but they're not seeing the entire forest, they're seeing the tree. And we're trying to give you a sense of what it's really like for the caller to navigate this path through all the different milestones that you put them through before they've completed their transaction successfully. And so this is what we partnered up with Amy to do in the contact center at Hometown Health. So consequently, we came in, we deployed the call recording on a representative sampling of calls and came back to Amy with some observations. And Amy, I'll let you just talk a little bit about receiving this information from us, and our audience can be reading this. But there's some remarkable observations here.
Sure, thank you. Yes, I knew when I needed to get my arms around the data and I needed help, I knew instantly to go to Sheila at Parlance. We had such a great experience at Renown, and I knew that I would get the data that I needed. And so in January, we were able to get that going, and the Parlance team was able to listen to thousands of calls. I believe, Sheila, you know the data as far as how many pages of data that you had. And they listened to and they were able to find that. So we, at the time, we do no longer have this, but Mark, if you'll just go back one slide for me, sorry.
Yeah.
There was 22 public-facing phone lines, and that's really important to note because we had a tendency to just create phone lines as a way to, the idea was sound, where we wanted to give our clients a direct line, but it didn't actually improve the experience because we didn't take care of things on the back end. So we had all these phone numbers, and I would call them and just to test where they go. And some of them went to an agent, some of them weren't answered, some of them just rang and rang. Because of Pylance, though, I only thought we had 16, but they were able to uncover that we actually had 22. So thank you. They found this was huge for us, that there was 54 potential paths that someone could take just to get to an actual representative. And that matched exactly. Finally, it was nice to have data that it matched with what my callers were saying. Is we'd get callers who would say, I have been disconnected. I've been trying to get a hold of you. I pressed 1, then I pressed 4, then I pressed 5, and I got disconnected. And we weren't seeing any of that because on our end, we were just seeing that calls were smoothly coming in, but we didn't see all the barriers that they were experiencing. And that kind of leads into the 20%. There was many broken links in there. So we had, and it's common that, a call center will transfer to an external source if they're not really meant to answer the calls. And since we're an insurance agency, we transferred to a vendor. Well, the vendor changed their number, and we never updated it. And so what a poor experience for our customer to have to call in and they're trying to get a hold of maybe their, dental provider and the call is dropped. We also found out of that is that I believe it was about 21% were actually automated calls, so an automated system trying to call us, and it was clogging up our system, right? It was preventing, because they weren't actually going anywhere because they were automated, so they weren't pressing 1, 2, or 3 or whatever, and so they weren't getting their calls completed either, so we had to reroute those to fax lines. And then we also found that our providers did have different destinations and expectations than our members. We still continue. We've been live with Parlance for 8 months now. We continue. I just actually emailed someone else with the changes we make because I appreciate that Parlance helps us to every single day analyze what our callers are actually saying. But it was great to siphon off the providers from the members so that they weren't commingling. Not that they can't, but then we could have some agents that just helped members and some agents that just helped providers. But these observations were priceless, monumental for me to be able to have something hard and concrete to talk to my senior leaders about.
Right. So let's talk about that a little bit. So we have some data that we can look at that you were seeing, that's giving you information about, okay, look, here's who's calling. It's not that we don't know who's calling, but look at the percentages and how they break down. And then let's look at what's going on when people aren't navigating the IVR entirely. What's the disposition of those calls? What's going on with them? And then also another piece of data that is very good for you to have is the sorry about that. The call intent by caller type, which I think is very important. And you were mentioning that earlier about, this need to recognize, look at how many providers we have calling. Their needs are very different from members. Let's see about segmenting off and really personalizing and being predictive when we have callers and or members and providers calling. So then we can look at sort of, you talked about the many call paths and what's really going on here. To have 54 call paths and 96% of them are, or 94%, whatever, are self-selecting into 4 different places. There's a real opportunity for making things efficient, more streamlined, easier, faster, quicker, everything good for the caller. So looking at all of this data, we presented this to Hometown Health, but we also had some recommendations from the point of view of the caller. And Parlance works with so many customers around developing smooth, quick caller experiences. We understand through the analysis that we do caller expectations and how good it can be for callers. So we came with some recommendations, and this is by no means the be-all, end-all. It's just based on, from the point of view of the caller, some changes you can make very easily to make things better for those callers. And then it became time, and this is where Amy really steps in to talk about implementing change. You want to talk about this process now that you've got this information, Amy, and then what that was like for you?
Yes. Well, as I did say, and just really want to emphasize, is that number one there is that was huge for us. When I like the word choice, stunned, we were absolutely stunned by what we had found. I knew based off of the verbal feedback I was getting that the IVR was difficult to maneuver, but I had no idea those hard facts. I did not realize that it would take 54 pressings just to get to an agent. I mean, that's pretty huge. And it definitely reflected how by the time a caller dropped into an agent queue, the caller would many times be exasperated and frustrated. So it was great to have data to pair with what the members were saying, so that the senior leadership would say, "Oh my gosh, I see that. Yes, that makes sense. I understand. So now what do we do?" And I like how they said that. Now what do we do? And it was great for me because we know that senior leadership needs hard data, right? I have been saying for a few months what we were experiencing, but this hard data was 100% what I needed to get their attention. And so then they immediately said, "Now what do we do?" And it was a nice moment. I think any leader can appreciate the beaming moment of, "Yay, I have their attention." And I said, "Well, we need to improve our IVR. We need to bring in Parlance." I'm fortunate that Parlance had already worked with our hospital Renown, and so there was definitely already some foundational rapport there. And so it was quick. It was easy to bring Parlance in as far as a lot of the things have been vetted behind the scenes with our IT and getting BAA signed, and it was already that trust and proof that they could deliver. So I will say that was very helpful for us. But they didn't hesitate. They immediately said, "Yep, get going with Parlance, get what you need done." And then number three, and we're still, I think that we're climbing over it, but we didn't actually implement Parlance. We narrowed everything down to 2 lines. So all those 22 public facing lines, we actually narrowed it down to our Medicare Advantage public facing line, and then just a general catch-all public-facing line. And so we first went live with our general, if you will, in about March, and we're still making some tweaks there, but I think we're starting to smooth sail. And then we did our Medicare Advantage line at the end of July. So we're still doing some tweaks, nothing on Parlance on us, because Parlance has been helpful to say, "We noticed your callers are saying this," or "We noticed they're not responding the way we've prompted them." But why I tell you all that is because I've also had to change the culture behind the scenes here. So what it did do is it definitely sped up the customer experience. And behind the scenes, our staff has had to be a little bit more in tune with calls. So because the previous IVR slowed down the rate at which someone got connected to an agent, it gave us a false sense of what was really happening. So I've noticed that our customer service reps have had to evolve and change, because at first they thought, "Oh my gosh, we're getting all these new calls." That wasn't the case. It was just that the callers were actually getting to their destination in a much more efficient manner. And we've changed by expanding our customer service hours. Huge commitment for us. We were a traditional Monday through Friday, 8 a.m. to 5 p.m. And it was really nice to be able to offer this to our community. Our community came back and said, "Thank you so much for being here on a Sunday. I have a procedure tomorrow morning. I just wanted to know what my copay was." And that was a culture change for all of our seasoned staff, because they were used to Monday through Friday, 8 to 5. So we've had a lot of culture change, both with the customers and what they can expect, and then our customer service reps and our senior leadership as well. But I would say that we're good at number one, we've done number two, and we're climbing over the hump as far as transforming our culture, and it's going really well.
Yeah, and that's a great process. I think one of the most interesting things about your story is how I've watched you from day one, and you're really moving through this process, and it's impressive because change is hard, and at one point you talked about being a pioneer and how difficult it is for pioneers, and I've watched you do it, and it's very interesting to see the business pivot somewhat. I'm going to go to the next slide here, and we're going to talk about we talked about the 54 possible paths. When you put that earlier IVR, the legacy IVR, on paper, it amounted to 12 pages of 12-point font to read through, and we narrowed it down to this single Visio diagram, basically looking at those paths that are most taken and trying to make it as streamlined and as easy as possible for customers. And we'll continue to make it easier and easier as we do some work with caller ID, et cetera. And what happens there, an important aspect of this diagram here is that this is not a static diagram. We deliver a managed service, and Amy and our team is constantly looking at the effectiveness of this design and where we should be making minor changes based on how much success callers are having with it. And another very important aspect of what you're seeing in here is that at any point, member or provider is able to say, just get me to an operator. If they need to pivot out for whatever reason and talk to somebody live, we make that easy too. So this is really all about making things very nice for the callers. And then we can look at a little bit, Amy, about what we're seeing with now that you've deployed the adaptive speech to replace that legacy IVR. I think I'll let you talk a little bit about how that's going, and we can show our audience some of these results, reducing handling time and.
So we've seen that, as I said earlier, the callers now navigate much quickly. I saw that screen there that it's definitely less than 34 seconds that our callers can navigate through our phone menu. And it used to be minutes. I mean, I had people tell me it took them 10 minutes by the time the menu answered their call and they got to a customer service agent. So that's been huge for us to navigate quickly for the caller. And as you said, they can have a bailout. And I really appreciate how much you can tweak the system so that parlance, you can make it sensitive. So I've built it to where, because we are dealing with a wide range of members, is that if they just kind of have anything inaudible, they kind of grumble or you can't understand, we force that to a call or to a live person so that the caller isn't frustrated with going, gosh, dang it, I said this. So I really like that we're able to make it sensitive. So we've also noticed that our handle time as far as our abandonment rate. We still may deal with abandonment rate in a whole different manner as far as queue holds, but as far as abandonment rate during the menu, that is decreased significantly. We don't have people abandoning during the menu. And if people are abandoning, what we have found, and it's less than 4%, which it was previously, as you can see here, 45%, a little over actually. Now when people abandon, we have found that, and again, it's less than 4, but it's mostly someone didn't even say something. So they called, they engage with the system, and they hang up. So we take that to mean misdialed, maybe cell connection. And so that's nice that it went from, 45, 47% down to 4% abandonment during the phone menu. So that's been, look at that. That's a huge improvement.
Yeah. Big change. And then here, the self-service impact, just, the ability to have people successfully getting to what they need. And in a setting like the contact center that you're in, where you have a real variety of members calling, this is a pretty robust self-serve rate, given the variety of their needs and their ability and willingness to self-serve. And again, that 40% that's moving over that requires assistance, they get to that assistance very, very quickly. And that's important to know too, that it doesn't feel like they've hit a speed bump or they failed. It's just that we're going to connect you to a representative who can help better triage this call. Yeah.
Agreed.
Yeah. And so I guess in this final thoughts portion here, I think it'd be nice to hear you talk a little bit about that kind of, besides implementing and replacing the IVR. We gave you a lot of data there with the CX Insights study. We had recommendations around caller experience, but I know you're thinking, and of course you're always thinking of caller experience at the heart of it. I'm just wondering if you can expound a little bit about how those results impacted your thinking strategically going forward beyond just replacing that IVR.
Yeah. What I was earlier when you and I were talking too is I find that there's in the health insurance industry that every provider or vendor that I've looked at to assist us with our systems, I have not found anyone that has worked with a health insurance agency. And so why that's important to note is because I've had to really know what I need. And so when I go to a vendor and say, can you do this? They scratch their head because they're like, oh, we haven't done that before. So here's an example. and I'm grateful that Parlance will work for us with that, is a lot of our callers are provider offices, as you saw, that 73%, and they're just calling for sheer eligibility verification. And they have, these are providers. They serve hundreds of patients, and so they have many, many, many to go through. And unfortunately, those calls can take up to 20 minutes because they could have 20 patients they need to check about. For some of our providers, we do have a portal, and for some of them, we don't, and that's an internal process that we have for protection purposes. And so, what we want to build is a self service option for these providers. And so, we're trying to, so you said, what's the strategy? Is to take it further, trying to, yes, we clean up our IVR, but let's take it further. Is that how can we truly satisfy our customers? And again, our customers consist of doctors' offices calling us, and then also the actual person who is insured. And we want to be able to, the people who call us that are insured, they're you and me. They're calling because they're fearful about something that's coming up, or they're fearful about a bill they just received. And that's very important to us because we really recognize that these are individuals. These are folks out there, earning money. They are scared about any additional bills. That's why they chose a good insurance plan. So we really want to focus all of our attention on those folks because each one is unique, right? It's very difficult to self-service with some of our members because each of their cases are unique. However, as I said, 73% is our provider. So how can we give them what they need quickly and efficiently so that we can, use all of our human resources on those members? So we're working with Parlance. That's our next strategy. At trying to build a self-service menu that can talk to our system so that, if a provider calls in, they can just get the eligibility, the benefits, the authorization information very quickly just by speaking. They can write it all down and they can move along their way, and they never have to, not that we don't want them to talk to a person, but if it's something they can self-service, they're good. It'll peel calls off. We can focus on the complicated cases. So that's in our next strategic vision, and that's what we hope to do with Parlance.
Well, and that's a great application for them because they make the same call over and over and over again. So they become very adept at using the automation, the speech automation. They'll be successful very quickly with that, right?
Yep.
Good. All right. Well, it looks like we're reaching the end of our time here. Amy, I want to thank you very much for sharing your story with our audience here as you grow this business and adapt to the changes that are coming your way, as I say, managing growth. So thank you very much. And best of luck in the next phases.
Thank you for having me, and I'm happy if there's any questions afterwards. If Sheila or Mark, you want to find a way to facilitate them and give them back to me. I know that this is a very tough industry and it's always changing, and I'm happy to help anyone navigate through it instead of having to go through all the muck that I had to go through.
Well, that's great. And that's a very generous offer, and I hope the audience will take us up on that because you have a lot of good information to share. All right. Thank you so much, and thank you everybody for attending.